I have made the experience that we have to, if we have the feeling that the patient have very high expectations and we cannot follow and we cannot give them these expectations, we have to discuss again with him and then up to one point to say, I cannot give you what you like. It's not possible. Sometimes I have little girls that visit me with pictures from artists with a very thin skin that would like to have a very high, let's say, degrees of the volume of the nasal tip, and they have a very thick skin. So this is not possible to do that. And I think first is the communication with the patient.
For me, the worst experience in rhinoplasty is when a patient is not satisfied with the result that you had in mind and the result that you considered to be as good as it can be. And that makes us now investing a lot of time during the preoperative counseling in order to make sure that the patient is fully aware of the choice of the surgery, of the choice of the surgeon, and what are the specific aims and specific details of the changes that we are aiming for during rhinoplasty.
My worst experience in rhinoplasty is when I accepted a female that came to me crying with 50 pictures on the ground and saying that she had been operated 3 times and she wanted me to correct her nose. For 1 year she prayed me and I said no, then I accepted. And then for 1 year after I had to accept phone calls to my assistants and phone calls to me and visits and consultations of this patient because she was never happy. She was a dysmorphophobic patient. How can we prevent this? We can prevent the worst experience in rhinoplasty by putting the patient in a psychological assessment, and then if there is a red flag, we have to stop from saying yes to this patient.
Oh, I have a lot of bad experiences, but the main thing is if you choose a wrong patient. That's the main thing. So a successful rhinoplasty begins with a good selection of your patient. If you can select the patient who will be happy with the result, that's the best thing you can do to avoid patients who will never be satisfied. And there is a certain category of patients that no matter what you do, they will never be satisfied because they have a psychological problem. So you have to screen these out and exclude them from your patient population. That's the most successful thing that you can ever do.